You're not the fiscal conservative hero of your own story. You're the villain. You're the villain who steals medicine from sick people while claiming it's for the greater good. Well, here we are. The GOP-led Senate has passed their version of the Big Beautiful Bill Act, which will go back to the House for reconciliation, but not before the Democrats chalked up a small victory. That's right, after countless hours of debate and wrangling on the floor of the Senate, the Democrats got them to change the name of the bill. I'm so proud. So proud. So what does the bill formerly known as the Big Beautiful One actually do? Well, among other things, it absolutely guts Medicaid. This is real. This is happening. This is official. But it also cuts other Biden-era programs and provisions from, other landmark bills that they passed, and extends generous tax cuts for the wealthy and creates additional loopholes for wealthy people and corporations to evade taxes. But the focus today that I want to draw your attention to is how the Trump White House is using immigration as a smokescreen for all of these cuts to Medicaid in particular. So let's talk about it.
UNFTR.
What do you tell the nearly 12 million people that are on the brink of losing access to Medicaid?
Well, no, again, that's not right. 1.4 million are illegal aliens. Then a huge percent of that are the able-bodied working people who will need to go back to work.
It's the ultimate misdirect. Point at immigrants while you pick the pockets of working families who depend on Medicaid for their health care. It's the oldest trick in the authoritarian playbook. Blame the most vulnerable people while enriching the most powerful. And the numbers don't lie. And when you dig into what's actually happening here, the whole immigration ruse just sort of falls apart. This isn't about protecting taxpayers from fraud. This isn't about stopping abuse of the system. This is about taking healthcare away from millions of Americans while the wealthy get another tax break they absolutely don't need. And this guy is very much to blame for the race-baiting immigration smokescreen.
The official continued, quote, Stephen Miller wants everybody arrested. Why aren't you at Home Depot? Why aren't you at 7-Eleven?
What a disgusting ghoul this guy is. His immigration war has gone way beyond any reasonable enforcement policy. So as you see, the reports indicate that he verbally dressed down the top ICE officials, telling them to start terrorizing neighborhoods and picking up immigrants off the streets at Home Depot and 7-Eleven parking lots. The war on immigrants has gone so far beyond chasing down immigrants who are in the criminal justice system. It's become an all-out war on Hispanic people. And now Iranian Americans are being caught up in the deportation frenzy because this isn't law enforcement. This is systematic intimidation designed to create fear among entire communities. When you're telling ICE to target people at places where day laborers gather to find work, you're not going after criminals. You're going after people trying to survive and feed their families, very valuable parts of this workforce. And when you expand beyond targeting actual criminals to conducting sweeps in neighborhoods, you've crossed the line from enforcement to persecution. But here's the thing about Miller's approach. It's not actually about immigration policy. It's about creating a culture and climate of fear and chaos that allows this administration to push through policies that would otherwise be politically impossible. While everyone's focused on the dramatic raids and the human tragedy of family separations, a whole other tragedy is unfolding in the budget. As has been said, the cruelty is the point, but it's also the distraction. The expansion to include Iranian Americans shows that this isn't even about immigration status anymore. It's about targeting anyone who doesn't fit their very narrow definition of who belongs in America. White people. Yes, of course. And those other white people from South Africa, the ones that are caught up in the imaginary white genocide. This is authoritarianism 101. Create an atmosphere of fear, target vulnerable populations, and use that chaos to consolidate power and enrich your allies. The White House talking points try to frame these Medicaid cuts as simply eliminating fraud and waste through work requirements and rule enforcement, all while claiming that they need to strip immigrants of their ability to access Medicaid illegally. It's a neat little package that sounds reasonable on the surface. I mean, who doesn't want to eliminate fraud and waste, right? But let's break down what eliminating fraud and waste actually means in this context. The bill includes requiring childless adults and parents of children older than 14 to work, volunteer, or attend school for 80 hours a month as a condition of enrollment, unless they qualify for some exception that we don't know. This work requirement alone accounts for $317 billion in cuts over the next decade, the largest single cut in the entire package. Now think about that for a moment. The biggest waste they've identified isn't administrative bloat or actual fraud. It's healthcare for people who can't work enough hours. We're talking about people who might be caring for elderly parents, dealing with disabilities that don't qualify them for disability benefits, working unstable gig economy jobs, or simply unable to find work consistent in their communities. The bill also requires states to check eligibility of people in Medicaid expansion every 6 months instead of once a year, cutting $58 billion, and this will be a massive headache for the states to administer. Another provision allows states to require more paperwork and more frequent eligibility checks, cutting $78 billion, more administrative paperwork on the backs of the states who are getting their funding cut. So how's this going to happen? These aren't anti-fraud measures. They're bureaucratic barriers designed to make it so difficult to maintain coverage that people give up. So when you add up all this fraud prevention, you're looking at over $450 billion in cuts. But the actual fraud rate in Medicaid is tiny compared to these numbers. This isn't about waste. It's about making healthcare inaccessible to working families while maintaining the fiction that it's all about fiscal responsibility and then also the immigrant problem. So here's where the administration's immigration rhetoric completely falls apart specifically. Immigrants who come and seek asylum are not illegal. For all the people that say, I just wish they'd do it the right way, that's the right goddamn way to do it. The reason we know who they are and where they are is because they presented themselves and said, I'm here, I'd like to stay. That's a legal process. That's actually the proper process to follow under U.S. law. Seeking asylum is an entirely legal way to seek residence in the United States, and those waiting for courts to determine their eligibility aren't entitled to any welfare programs, especially Medicaid. Let's be crystal clear about the law. Under current federal law, undocumented immigrants are not eligible for federally funded Medicaid or CHIP. They don't get Social Security benefits, free housing, food stamps, or SNAP. Federal law explicitly bars people living in the U.S. without legal status from enrolling in these programs, except for limited emergency medical services, because one of the beautiful things about the Hippocratic Oath is that we still, at a minimum, believe in the obligation to treat people in emergency situations, and we'll talk more about that in a moment. But even among lawfully present immigrants, most must wait 5 years after obtaining qualified status before they are eligible for Medicaid. So the administration keeps talking about cutting illegal access to Medicaid, but that's like saying that you're trying to prevent unicorns from buying guns. You're solving a problem that does not exist. Now, some states do use their own funds, not federal Medicaid dollars, to provide health coverage to certain undocumented immigrants, such as children or pregnant women. But these state-funded programs are not federally funded Medicaid, even if they're sometimes described as Medicaid-like. Recent GOP proposals have conflated these state-funded programs with Medicaid, claiming that millions of illegal aliens, a term that just should be gone, are on Medicaid when they're actually referring to state-funded health coverage using state money. The reality is that asylum seekers who are following the legal process are stuck in immigration limbo for years while the courts process their cases. And during that time, they have access to almost nothing. Again, no Medicaid, no CHIP, no food stamps, no housing assistance. They're expected to survive on their own while navigating a legal system that can take years to resolve their cases. So when the administration talks about cracking down on immigrants accessing Medicaid illegally, they're either ignorant or lying. So here's the truth about what undocumented immigrants receive from the federal government. If they show up in an emergency room, they can receive emergency medical care. That's it. That's the whole list. And this happens through emergency Medicaid, which reimburses hospitals for emergency services provided to immigrants who would have qualified for Medicaid but for their immigration status. So the federal government currently pays 90% of costs in states that expanded Medicaid under the ACA, and the state's regular federal medical assistance percentage in non-expansion states. So this program covers only true emergency conditions, labor and delivery, heart attacks, severe injuries, and it accounts for less than 1% of total Medicaid spending. Now, the Senate bill cuts $28 billion from this program specifically over 10 years. So that's the piece that Scott Bessent was talking about in the beginning. So that's $2.8 billion per year. Now, the federal budget is approximately $7 trillion annually now. We've covered that before. So that means that emergency Medicaid for undocumented immigrants represents about 0.04% of the entire federal budget. 0.04%. To put that in perspective, that's like arguing over 40 cents in a $1,000 budget. It is a rounding error, and it's less than what we probably spend on office supplies for Doge. But this microscopic portion of the budget has become one of the administration's leading talking points for gutting the entire Medicaid system. Outside of emergency medical care, the only other benefit undocumented immigrants receive is public schooling for their children. But even that's covered by local real estate taxes, and immigrants pay landlords who remit property taxes to school districts. So even if they're renters, they're technically paying property taxes through their rent. So that leaves school lunches and emergency hospital visits as the only programs that are technically free to immigrants. Now, the absurdity of making this microscopic expense one of the leading talking points to justify massive Medicaid cuts reveals the true nature of this campaign. This isn't about fiscal responsibility or stopping abuse. It's about manufacturing outrage over pennies while you're stealing hundreds of dollars. When you're cutting $28 billion over 10 years from a program that serves people having heart attacks and women giving birth, you're not the fiscal conservative hero of your own story. You're the villain. You're the villain who steals medicine from sick people while claiming it's for the greater good. And the truth becomes undeniable when you look at the full scope of what's being cut versus what's being preserved and expanded. This is a catastrophic gutting of Medicaid that reveals this administration's real priority: waging war on the poor while enriching the wealthy. The numbers tell the story. Beyond the $317 billion in work requirements that we discussed, the bill includes $183 billion in cuts from provider taxes, $149 billion from limiting state-directed payments, $85 billion from canceling rules that help low-income Medicare beneficiaries pay premiums, $78 billion from new eligibility requirements, and $58 billion for more frequent eligibility checks. Then there are the smaller but equally cruel cuts. $7.5 billion from requiring co-payments of up to $35 for medical services for Medicaid patients, and $6.2 billion from limiting immigrant Medicaid coverage by restricting eligibility after a 5-year waiting period to only green card holders and certain other immigrants, excluding many who are currently lawfully present. So you add it all up, and you're looking at nearly $900 billion in Medicaid cuts over the next 10 years. These aren't tweaks around the margins. This is dismantling the healthcare safety net for America's most vulnerable populations. And what's happening on the other side of the ledger? Generous tax cuts for the wealthy and additional loopholes to help wealthy people and corporations evade taxes. While working families lose their health care, billionaires get another tax break. The co-payment requirement perfectly illustrates the cruelty of this approach. I mean, we're talking about people so poor they qualify for Medicaid, and now they'll have to pay up to $35 every time they see a doctor. For a family living paycheck to paycheck, that's another $35 that might mean choosing between medication and groceries, between a doctor's visit and keeping the lights on. The work requirements revealed the fundamental misunderstanding or deliberate misrepresentation of poverty Most Medicaid recipients who can work do work. They're working multiple part-time jobs without benefits. They're caring for children or elderly relatives. They're dealing with health issues that make consistent employment difficult but don't qualify them for disability. When you require 80 hours of work per month and create bureaucratic barriers to maintaining coverage, you're not encouraging self-sufficiency. You're creating a system designed to kick people off healthcare when they're most vulnerable. This isn't about immigration. This isn't about fraud and waste and abuse. This is about taking healthcare away from millions of Americans while the wealthy get richer. So let's really be clear about this. The immigration rhetoric is just a smokescreen. It's the distraction that allows them to pick the pockets of the working poor while everyone is looking the other way. Yes, the cruelty is the point, but the money is the goal. And while we're arguing about $2.8 billion in emergency room visits for undocumented immigrants, they're stealing $900 billion from the people who need health care the most to, quote unquote, cover the tax breaks. That's not fiscally conservative. It's not protecting anybody. This is just theft with great PR. Here endeth the lesson. So I got some cool and kind of humbling news to report at UNFTR. We've joined on as a regular contributor to the Midas Touch Network, where they're letting us infect their audience with our socioeconomic message of progressivism. It's an amazing opportunity to welcome new unfuckers into the fold and collaborate with the Mycelis brothers. So if you're here from Midas, welcome. And for the faithful, thank you for continuing to support our mission. As you know, we're entirely member-supported, and with your help, we're adding new resources to our website at unftr.com and expanding our content offerings here and on the podcast. So if you're not already signed up for our free weekly newsletter, make sure to head over to the website to subscribe. And check out our membership benefits if you're in a position to support independent media like these fine unfuckers who make the UNFTR world go round.
This is the story of a political pundit who looked at the world around him and just said, fuck it. Gives the middle finger to authority and says, kiss my ass. But instead of a revolution, he started a podcast. It's just what the world needs. Started a podcast. Another basic white guy who started a podcast. But it's fun because he curses all through the